Hello viewers, I am Dr. Seema Jain, the Director of Fertility Unit at Cloudnine Group of Hospitals based out of Pimple Saudagar branch in Pune. With increase in the age of women who are wanting to conceive, egg donation has become an important part of the assisted reproductive fertility treatment. Now, what does egg donation involve? Basically, egg donation involves giving hormonal injections to the egg donor to create more number of eggs and then retrieving those eggs and fertilizing it with the recipient's husband's sperm, forming embryos out of it and then putting it back into the recipient's uterus. With the new ART laws, the number of eggs that can be retrieved per cycle is only around 7. Egg donation as such is not a painful procedure. It's just the pain of the injections and the discipline of taking the injections on a daily basis. Even if the procedure which is done under anesthesia is not painful. One of the risks which can be associated with egg donation is that if more number of eggs are produced, it can lead to what is known as ovarian hyperstimulation syndrome, which these days we have a lot of medications to avoid. So all in all, egg donation is a pretty safe procedure.